Do you have knee pain that's right below the kneecap and it gets worse with activities such as running, jumping, squatting, and bending? You may be having patellar tendonitis. In this episode, we're going to talk about what causes patellar tendonitis and how to decrease the pain in your knees. If living pain-free equates to a better life for you, subscribe to the channel and find out what you can do to live your best life. Welcome to Better Mobility, Better Life, where you can learn how to break mental and physical barriers to become a better athlete, a more functional human, and how to age with grace using physical therapy techniques. In this episode, we are taking a deep dive into pain below the kneecap called patellar tendonitis and some simple techniques to try to decrease the pain in your knees. Please note that this information is purely educational and it is not medical advice. If your signs and your symptoms don't go away, I encourage you to see your medical professional. If you have been experiencing pain below the kneecap, you may have what we call patellar tendonitis. The quadriceps muscle is made of 4 different muscles that start at the hip and they go down below the kneecap. Once they reach the kneecap, connective tissue goes over the kneecap and your patellar tendon inserts into a bony protuberance in your tibia, which is the bone right below your femur. Anything that activates this quad muscle will just pull on that tibia, and repetitive action will actually cause you to get a little tendonitis. We see this a lot with athletes that have to jump or squat a lot, and you may have heard it called jumper's knee. A lot of times, it's not enough to take time off of the sport, because once you go back, it will come back as well. In this episode, I want to concentrate on specific soft tissue techniques and exercises that can provide you with some relief. All right, so the first thing that you are going to do is a little cross friction massage. And so if you just sit down with your legs extended out, you're gonna find that little bony protuberance that sticks out on your tibia bone, and just go up from that and you'll feel some tenderness in that patella tendon. Where you feel the tenderness, I'm gonna have you do what's called a cross friction massage, where you just go perpendicular to the fibers. So the fibers are all running the lengthwise of your knee, and you're just gonna go horizontally across those fibers. And you're just gonna go a couple minutes, maybe 1 to 2 minutes, just massaging, finding those tender areas, and it should start to get a little less tender the more that you do it. Again, just go for 2 to 3 minutes at a time and then come back to it later, maybe 2 or 3 times a day, and that will help to realign a lot of those fibers that might be malaligned. All right. So the next exercise that I'm gonna have you do, or it's actually a mobilization, is you're gonna take your kneecap and you're just gonna mobilize it in 4 different directions. You're gonna go up, and then you're gonna go down, and you'll go side to side, just making sure that that kneecap has a good amount of mobility in it. The first actual exercise that I'm gonna have you do is stretching out your quad muscles. What you're gonna do for that is, if you have a belt, that might be handy. You're going to turn over onto your stomach, loop that belt around your foot, and I'm going to have you pull your ankle towards your bottom. As you do this, you should feel a nice stretch in the front part of your thigh, that's stretching out that quad muscle. If there's a lot of pain in that knee joint, then back off a little bit and see if you can still get a stretch in the front part of your quad. This exercise, I'm gonna have you hold for 30 seconds at a time. You're gonna do it 3 times per each leg. And then if you can do this 2 or 3 times a day initially, that's gonna be the best for you. The next exercise that I'm gonna have you do is a quad set. So you're going to sit long with your leg extended out, and I'm gonna have you just squeeze that quad, driving that knee down into the mat or the bed, and you should see that quad start to dimple up on each side. It may help for you to bring your toes back towards your nose. You'll get a stronger quad set that way, and I want you to hold for about 3 to 5 seconds. This, I want you to do 3 sets of 10 at a time, and you can start with 2 or 3 times a day in order to help strengthen that quad muscle. Next, we're gonna still work that quad. I'm gonna have you go down into a lying down position. You can support yourself on your elbows if you want to. And this is called a straight leg raise. You're going to start with that quad nice and tight, pushing that knee down into the mat. Bring those toes back up to your nose, and you're gonna lift from the hip halfway up to the other thigh, and then slowly come back down. So hold it up there at the top for about 2 to 3 seconds, and then slowly come back down. Again, we're strengthening that quad, and one thing I wanna make sure is that you're not bending that knee as you come back down. You wanna keep that solid quad contraction. So with this exercise, I'm gonna have you do 3 sets of 10. Then we also wanna strengthen the hips because they're our support system when we're doing squatting and running and jumping. So I will have you get on your side, extend that top leg out, and make sure that you're in good alignment with that hip pointed straight up to the ceiling, and you're going to just lift from the hip joint, keeping that quad engaged and that leg straight. Again, you can bring those toes back towards your nose. That will help to keep that knee straight the entire time, and I'm gonna have you try for 2 to 3 sets of 10. You might have to start off with about 2 sets. If you're fatiguing, make sure you take breaks, and you should be feeling a nice burn through the side of the hip. So those are some specific exercises that you can do if you're feeling pain below that kneecap. Again, I'd advise you to stay away from any repetitive activity that seems to make that knee pain worse and try to give it a rest break. If you've enjoyed this episode or you want to learn more about the types of knee pain and approaches for relieving that pain, make sure to click on the video below. All right, guys, until next time.